And our guest today is our good friend Nathan Jones, who happens to be from Xlear Incorporated. He is the founder, and it's been almost 2 decades since this xylitol-based company has revolutionized the whole health industry by the all-natural approach to upper respiratory conditions as well as oral health, and has improved the quality of life for people all around the globe. We know it's been amazing for our own quality of life here in the New England area. And Nate, welcome back.
Hey, thanks for having me. Thanks for having me back.
We saw today that the CDC is saying that down in particularly in the southern regions like Florida, the flu is running rampant earlier this year than they ever expected. There are also, we've noticed here up in the New England area that a lot of people are sick with sinus and bronchial infections. And, they keep doing the same old stuff that the doctors are recommending, but they're not getting better. Do you have a solution for them?
Well, just like washing your hands, washing your nose is going to help. And I'm actually in San Diego this weekend. I just yesterday was meeting with all of the trainers from Major League Baseball.
Oh, wow.
And the topic of conversation was your own New England Patriots, because they were all sick and not playing their game last week.
Yeah, and we lost.
Yeah, exactly. And so anyways, no, I mean, that's what the product the nasal spray that we sell that was invented by my father 20 years ago. That's what it was developed to do. It was developed to prevent upper respiratory infections. And the reason why is simple, because it washes away bacteria. Okay, the studies show that the xylitol blocks bacterial adhesion to the common pathogens and common bacteria that live in your upper airway that cause all of these upper respiratory infections. And if you just block their ability to adhere and wash them away, I mean, I've been sick once in 22 years.
That's amazing.
I have kids that have never been sick a day in their life.
And wouldn't that be nice if everybody could say that?
Yeah, it would be.
If we can kind of take a little bit step back, just because I know we have a bunch of new listeners, particularly in the Jacksonville area in Florida, as to what does xylitol do as well as far as like biofilm? What is biofilm, and how does xylitol affect that?
Well, biofilms are bacterial. The way that I describe it is they're bacterial cities. When humans, you get enough of them, they build a city. And the bacteria, they kind of do the same thing, and it's just kind of a gelatinous mass, and it protects the bacteria. And when people have chronic sinus infections or chronic ear infections, it's because there is a biofilm buildup, and you can treat it with antibiotics, but antibiotics will not get to the bacteria inside the biofilm. The biofilm is a protective structure that if the bacteria inside it feel like it's a harmful thing that's coming to it, it doesn't let it into the biofilm. The reason why xylitol gets into that biofilm is because it looks like food. It looks like sugar. I mean, it is a sugar. It's just a different molecular sugar than the sucrose and the glucose and the fructose and the sorbitol and the maltitol and the mannitol that these bacteria live on. It's a 5-carbon sugar. And so the bacteria, it's allowed into this matrix, into this biofilm, and the bacteria are going to start eating it, and as they continue to eat it, they start dying off, and the whole matrix will fall apart. The original research behind xylitol in the 60s was how it was reducing biofilm in the mouth.
And so your dad, who is a pediatrician. So again, this isn't just some person who had an idea. This is somebody who has a medical background treating children that developed this Xlear nasal spray that helps to, again, not only wash out the sinuses, but break down this biofilm. Have you seen significant improvement and studies showing that xylitol again helps prevent like ear infections in children as well as sinus infections?
There have been a couple of studies. There was one. I'm trying to think of them off the top of my head, but there have been a couple of studies. There was one that was just presented, but this was about 2 years ago at one of the pediatric meetings where they used irrigation with xylitol, and not only did it reduce the incidence of rhinitis, that's the clinical term for those upper respiratory infections, but it also improved nitric oxide production, which was kind of interesting because nitric oxide helps with relaxing the blood vessels so that the oxygen can actually move back and forth across the blood vessel better. There's a study that was just published in September of this year where they looked at comparing fluticasone against xylitol, and the xylitol was actually as good as the fluticasone at treating the symptoms of rhinitis. But what it also showed, which was surprising but logical, was that the people using the xylitol actually healed better because the xylitol allowed the tissue to stay moist. And you need the tissue in your nose to be moist. And the xylitol allowed the tissue to stay moist so that it could actually heal and regenerate that tissue and become healthy again faster.
And so many people out there are using things like Flonase and other things that just tend to dry out and irritate the sinuses. The Xlear nasal spray, and you have a variety of different Xlear nasal sprays now that are effective as far as killing off what's going on up in the sinuses, more than the over-the-counter stuff that they're getting at the pharmacies.
Yeah. No, we've got a number of them, and you know the basic Xlear product is the daily hygiene product. Again, it was developed as a hygiene product, just like toothpaste, just like a bar of soap, just like taking a shower and washing your hands and brushing your teeth. It's something that should be done on a daily basis because what it's doing is it's helping to clean out the upper airway. Your nose filters out about 12,000 liters of air a day. And all this is doing is helping facilitate that cleansing. And then, I told you that I got sick once in 22 years. And when I got sick, what came out of that is I went and put some stuff into my nasal spray that would help kill off all of these bugs. Oregano, tea tree, eucalyptus, polyarco, a bunch of those. And it really shocked me because when I started talking to doctors, there is not a commercially available over-the-counter drug, like amoxicillin or Cipro. There is not a nasal spray available with an antibiotic in it, which really surprised me because the doctors are having people take systemic antibiotics even for a localized sinus infection or a localized infection somewhere. So if you do have some kind of an upper respiratory issue, you can use the Xlear Rescue, and that's going to help knock it down a lot faster.
We know we utilize it extensively at the Tree of Life Wellness Center at our practice, and people are floored. I mean, they've been having chronic sinus infections on antibiotics off and on, continuously, and found that just, utilizing the Xlear Rescue nasal spray, all done. They're fine. They haven't been on an antibiotic in over a year or two, and it's pretty amazing.
And that's a typical response.
Want to switch gears just a little bit. And again, anybody who has chronic bronchitis or sore throat, all that kind of stuff, make sure that you're washing out your sinuses with the Xlear nasal spray. And if you need to step it up, they have the Xlear Rescue nasal spray. But also, you just came back recently from a meeting talking with about 600 dentists and how xylitol can be really beneficial for oral health, which can have a major impact on people preventing heart disease.
Yeah, there's a lot of good research that's coming out now that talks about the connection between oral health, and not just heart health, but, brain health, Alzheimer's, diabetes, all of these systemic diseases. And what they're coming back to is saying, if you have oral issues like, periodontitis, gum disease, any of these, and your gums and your tissues are inflamed, it makes it easier for these bacteria to get through the tissue in your mouth and get straight into your bloodstream. And the way that it was described to me, I said, well, why would that, matter? I mean, isn't it like a plastic liner, your tissue? And the way that it was explained to me, it really makes sense. But, the cells that make up your tissue are a lot bigger than the bacterial cells. And if you take your bacterial cells and think of them as a bunch of beach balls, that are half inflated, because your cells, if they're healthy, they're very malleable. They don't have a cell wall, they have a membrane, and those membranes have to fit together to make a wall. But if they're inflamed and you fill all of those beach balls full, there's huge gaps in between the beach balls. And that's why it makes it easy for bacteria to go through this inflamed tissue.
And Nate, we were talking about oral health and how beneficial xylitol can be. And what are some of the best ways to utilize xylitol in the mouth to improve, protect against bacterial infections?
Well, the best way to use it is just to switch out products you already use for products that have xylitol. A lot of the pushback that we get from dentists is, you have to use it 4 times a day. That's so hard. Nobody's going to do that. But if you use toothpaste and mouthwash with xylitol in it, well, gosh, you're already halfway there. Now you only have to do 2 more. And so we have candy, and you have gum, and you have all these other delivery systems to make it fairly easy to get those other 2 exposures a day. If you drink tea or coffee with 1 thing of sugar, you just change it out for xylitol. And that's how easy it is. Because really what it's doing is it's taking the bacteria that make acid and targeting those bacteria, and all you're trying to do is get the sugars out of your mouth so that you starve those bacteria. And if you starve them, you're going to change the microbiome of bacteria in your mouth from bacteria that create acid to bacteria that don't.
And again, the bacteria has been linked to so many other health issues. And saw a study that even suggests that utilizing xylitol and preventing this bacteria in the mouth is beneficial for even people who have AFib.
I'm not aware of that study, so I would like to see it.
Yeah. There is also, I found, study showing that as far as wound care is concerned, again, looking at the biofilm that protects these infections that are difficult to get rid of, as well as colon cancer, that they found that the biofilm helps to protect the cancer cells that increases the inflammatory process, the sugars and things that are in people's diet, that utilizing xylitol helps to break down the biofilm and help protect against, bowel diseases, including bowel cancer.
Those ones I am familiar with. In fact, his name's Dr. Randall Walcott. He's the one that pioneered the use of using xylitol in treating wounds. And they would have open wounds that have been open for years that have these biofilms, and they just can't get them cleaned out. And they started using xylitol, and it broke down those biofilms and made it so that the antibiotics would work again. And when you're talking about cancer, there was a study published in September of 2016, I believe, where they had a bunch of people with oral cancer, and they just switched out 20% of their daily intake of glucose with xylitol. They didn't even cut them off sugar 100%. They cut them off 20% of their sugar and replaced it with xylitol, and it stopped the progression of oral cancer.
One of the popular products that we haven't talked about is that Xlear makes is the XyloSweet sugar replacement. I can tell you that stuff is phenomenal. You can, even lick it off your hand and it tastes exactly like sugar, but it's not going to have the devastating inflammatory aspect that sugar does, as well as, again, sugar contributes to cancer. So it's something I think people should, keep in mind. We got the holidays coming up, and, to include in their stockings the spry toothpaste for adults and children, as well as the different candies or mints. I've had a lot of patients who have dry mouth, and the Xylitol moisturizing spray from Xlear they absolutely love, particularly patients who are going through chemotherapy.
Yeah, no, the dry mouth products, almost all of the dry mouth products on the market have xylitol in it, because xylitol by its very nature is moisturizing. But we're the one that have one that has aloe vera in it. It also has, it's natural. It's non-GMO. There's no artificial ingredients in it. So if they really want one, and people that are going through cancer treatments, they usually do have dry mouth issues. And if you're going to use a dry mouth product, you should use one that's natural, especially when your immune system's compromised by cancer and the treatments for cancer.
We found it to be phenomenal. In particular, a big favorite is the mints, the lemon mints, the spry xylitol mints. People absolutely, they get the little pocket tube that they carry in their purse or in their pocket, as well as the jar that they keep on their nightstand or on their kitchen table, and find that, again, this dry mouth and a lot of medications, particularly blood pressure medications, cause dry mouth.
Yeah. Well, the gems are actually a great product for dry mouth because they do have the xylitol. They can just sit in your mouth. They'll keep it moist. But they also have calcium glycerophosphate, which is a form of calcium that will remineralize directly from your saliva into the enamel of your teeth.
And I just want to, again, people, if you want some more information or if you want a complete list of the retailers who sell the Xlear products, the moisturizer, the mints, the gums, the candies, the toothpaste, the sinus sprays. We got the XyloSweet. There's a whole list of different things. Make sure you go to Xlear.com. Again, that's Xlear.com. And it's also Xlear products are available at Walmart, CVS, Whole Foods, Vitamin Shop, Rite Aid. You guys are spreading out all over the place. I think it's so wonderful.
Hey, we're spreading out all over, and our goal is to save people money, keep them healthy.
And that's
stay healthy. You don't have to spend more money on getting better.
And for people particularly who say, I've done everything, I've taken every medication out there and stuff, and I'm not getting better. I keep getting my bronchitis. I keep getting my sinus infections. I bet you dollars to donuts that they have not tried any of the Xlear products with xylitol to help ward those things off.
I would be willing to bet that too.
And is there any final thing you would like to say to our audience, Nathan, to encourage them to utilize the Xlear products?
Well, you know what they say: if the ounce of prevention is worth a pound of cure, and our products are 100% geared to stop you from getting sick in the first place through hygiene. Because most of the reasons that people go and see a primary care physician is upper respiratory issues, whether it's allergies, whether it's asthma, whether it's cold, flus, sinus infection, ear infection. It is the number one reason why people go see a primary care provider. And if we can cut down a lot of those people having those issues and getting sick all the time, then we're not going to have a need for so many doctors.
And is there anyone...
And people are going to save money.
Is there anyone who cannot utilize xylitol products?
No, there isn't. I mean, there's some people that have a lower tolerance to eating it, but that would be using it as to cook with, the Xylitol. When you're using it in the nasal spray and in oral care products, we have yet to find anybody that can't tolerate it.
And so, again, it's something that everybody needs to check off and say, okay, this is what and it's not expensive. I mean, compared to a lot of the other things out there in the natural health world, it is so cost effective. You're going to save a bundle of money and all that other stuff that you're using that isn't working. Again, want to encourage people to go to xlear.com and check out their products. And Nate, is there a telephone number or other information that people can find out?
Yeah, they can call us at 877-599-5327. And there's people there from 8 to 6 Mountain Time, and they are more than happy to answer your questions. Ask for Mandy or Ari. They're both there. There's a couple other ones there, but Mandy's their supervisor. She'll answer any tough question you have.
Well, we want to thank you so much, Nate, for coming on, and we hope that you come back. Unfortunately, ran out of time. Could have talked to you for hours. Thank you so much.